very important initiative, partnerships in the community we're talking about today. You all had a great event in April. Terrence Thames, CEO of Coco Creative Agency, and Dr. Nathan Boonstra doing incredible work at Unity Point Health. Thank you both for being here today. And let's talk about the event that just passed April 24th. This was a pivotal day for our community on the health front. Yeah,
so Coco Creative partnered with Iowa Immunizes, which is supported by the Iowa Public Health Association, to do an event that highlighted and elevated the stories of minorities, their healthcare stories and their stories around vaccinations that are happening within minoritized communities.
And with that, the conversations that were happening, did you see the community coming together and talking about issues we generally don't talk about? You know, April's a month of awareness for that particular issue, but it needs to go beyond April.
Yeah, so the project that we did was sponsored by the CDC, CDC Foundation, called Our Story, Our Shot. And it was actually a video series where we captured stories of those who were telling their experiences, and that was culminated by a networking event and a panel discussion. So these stories are really important, and it was really, really great to bring all of them together and culminate it by an event like this.
And for the work that you do, Doctor, these events are critical because you're the one digging into the statistics. You're seeing people every day, and this is the change that needs to happen, right?
Yeah, and I'm fortunate enough to be chair of Iowa Immunizes, which is our state immunization coalition. So the entire purpose of Iowa Immunizes is to bring groups together to have these kinds of conversations, to talk about vaccine access, to talk about equity, and then also to make sure, I mean, our goal is to make sure that Iowa has as strong of immunization rates as possible, because that benefits everybody, and also to make sure that everybody gets good, reliable information. And so we have partners all over the community, whether it's health organizations, individuals, families, and we come together and we talk about kind of projects that we can do and people that we can partner with, and how can different partners in different communities work together to try to come up with approaches to some of these issues when it comes to access, when it comes to equity, which a lot of people don't realize are as serious of issues as they are.
It is easy to miss, you know, those public health campaigns that are saying get your flu shot, get your COVID shot, and to never get yourself in to get it. It almost kind of feels like a luxury in a lot of cases. You have an event coming up May 10th as well. Tell us about that.
Yeah, so I'll speak on it first just a bit. May 10th, there's a screening for a film that's called Shot in the Arm. The screening itself is sponsored by the Blank Children's Hospital and also Iowa Immunizes. And this film was made during the COVID time, and it really helps to dispel a lot of misinformation, but also dives into a lot of great information around our vaccine experience in our communities.
Yeah, and we're going to have the opportunity then afterwards to have some experts. I'm going to get to be on this panel to kind of discuss the issues that are in the film. I've had the opportunity to see a lot of the film even before it was finished, and just how it digs into how people are targeted with misinformation, how anti-vaccine groups utilize social media and kind of create impressions about vaccines that aren't necessarily accurate. It's really, it was a really eye-opening film to watch.
What has this been like for you both, you know, to partner and see a lot of community building, gaining momentum? It seems, you know, the pandemic was very challenging for everyone in these particular partnerships, but are we coming out of it? Do you see progress?
Well, I would say from our standpoint, being an agency that partnered with the Iowa Public Health Association, their goal is to strengthen and unite voices around public health in Iowa. And I'm glad that we were able to leverage our work in the area of video with our access to our community, minoritized communities, to help elevate that messaging. Because it was all about listening. It was all about capturing stories and listening to hear people's truths and get more understanding. The panel discussion that we had and the Q&A that happened at the event was very, very eye-opening, and it was very interactive, and I think it edified those who were in the room. So with all those things put together, I'm looking forward to the work that we're going to continue to do, but I'm glad that we have a partner like Iowa Immunizes and the Iowa Public Health Association to create these spaces to elevate voices in this with this particular type of work.
And it does. It takes a village of partnering and open conversations. And thank you for both. Everything that you both do collectively, it matters. You know, that is what creates that sustainable progress and elevation. Where can folks find you real quick before we go?
Yeah, they can always reach out. Well, for one, Iowa Immunizes, iowaimmunizes.org is the main place they want to go to get more information about the work that we're doing and work that's to come.
Okay. Thank you both for being here.
Thank
Just
you.
dropping all the knowledge. It's, health is empowerment, right?
Absolutely.